Hi, Dr. Karen here, and I'm going to show you how you would go about patching your eyes for any sort of symptoms related to your eyes. So I've had eye surgery in the past, and in fact, these tears required laser surgery, and also on this eye, I have some scar tissue from where the retina peeled away, and I actually have a little silastic implant called a buckle repair for this eye. So, for example, if you have an eye issue or you have an injury to the eye, you can actually use patches to help your body self-heal faster. So the patches I'm going to demonstrate today are the IceWave patches and the Carnosine patches. And we're also going to use an eye mask because you're going to patch right over the eye mask, okay? So the first thing is the IceWave. So you've got a white and a tan, and remember in your package, they're on each side of a divider. So if you find only tans or only whites, look a little bit deeper. You'll see there's a divider and the other patch color is on the other side of the divider. Okay, so that's one mistake that most people make. They call and go, I can only find tans. But there is indeed both white and tans in your package. So what I want to do is I want to put one on each eye over the eye patch. And how do you choose white on, should the white go on the right or the white should go on the left? It doesn't really matter, but if you have scar tissue, it's an old injury, or you have poor circulation on one eye versus the other, or worse circulation, I would put the white patch over the eye with the least circulation. But again, it's not a big deal. For example, if I had an eye, say it was injured and it was really red or swollen or a lot of blood vessels, so I got a red eye, I'd probably want to put the tan patch over that particular eye. But if it's a chronic issue or you've been told you have poor circulation, you might want to increase the energy and blood flow in that eye, so you may want to use the white patch. So in this case, since this is my eye, my left eye that has the implant in it, I'm going to use the white patch over top, and we're going to patch right over the eye mask. So I'm just putting it over here to estimate where my eyeball is. Now you don't have to patch underneath. You can actually patch right over top. So I'm patching right over my eyeball. It's about there. Okay, let me double check. Yeah, so I've, let's see. So I've got, yep, my white one over my left eye. Okay, and the tan is over the right. And I used tape here just because I'm just doing a demonstration, but you would actually peel the backings off and adhere these firmly to your eye mask, to the outside of your eye mask. Now it works right through clothing because it's energy, it's phototherapy. This energy penetrates right through clothing and in fact penetrates through a 6-inch wooden block. But anyway, we're not using wooden blocks here. But as long as you're within about 3 inches of the target area, you're fine. And remember, you got to hydrate well when you use the patches, right? So if you're using this at night, which you probably will be with the mask on, you want to make sure you hydrate well during the day. And that's usually about 2 liters of water per day. That translates to roughly about half, what was that? Half a gallon? Me and my metric. Okay, so I would say about 65 ounces, something like that. So it's about half a gallon of water per day. So now, so I've got the IceWave on, okay, and the Carnosine is going to go over whatever eye is the one that has most damage. You can also put it in the center. So if you have both eyes that are damaged, you can put it right in the center of your mask like this, or right over your forehead if you'd like. It's nice and handy on the mask. If you had surgery, for example, just on one eye, or one eye is more has more chronic issues or has poorer circulation in the other eye, you can actually stack that Carnosine patch right over top. Okay, once you take the backings off, these are pretty sticky. They'll stick right on top of each other. You can actually stick it right on that spot. So now I've got it stacked. I've got a Carnosine and a white IceWave on the left side, which is the side I have the scar tissue on, and then the tan on the right. So the white and the tan are different colors because it increases the flow of energy between the two colors. That's why you need both colors. So you can, again, stack the Carnosine or put it right in the middle if you're treating, the area around both eyes with that healing energy. And then all you got to do is, once you figured out where you want to put those patches on your eye mask, and you've hydrated during the day, you just sleep with your eye mask on. And voila, you have that nice healing phototherapy energy helping to penetrate into the eye area while you sleep at night. Pretty cool, huh? All right, and so you'll want to be changing your patches probably every day or so. They last about 12 hours, and I know you don't sleep 12 hours, but if you want to get the most out of them, I probably use one set per day, especially right after you've had any surgery, that kind of thing. Once you're feeling better, things are healing well, you can always use them less often, like every other night, for example, so you can have a mask-free night, you know, that sort of thing.